Hey guys, it's Samantha Buback, and this is my mini presentation. The systematic review that I have chosen and would like to cover with you all is titled Systematic Review of Nutrition Interventions for People Admitted to Hospital for Alcohol Withdrawal. And this was conducted by Cameron McLean, Linda Tapsell, Sarah Grafenauer, and Anne Therese McMahon. So let's dive right into the topic. Alcohol consumption is driven by both internal and external factors. These can be both negative or positive. Such factors include behavioral control, emotional coping strategies, social enjoyment, medical purposes, cultural practice, religious rituals, and sometimes for intoxication. There are guidelines available in at least 37 countries to reduce the health risks from alcohol consumption, though it is still a large issue. And the most recent systematic reviews suggest that there may be no safe level of alcohol consumption that outweighs the negative effects that's correlated with alcohol consumption. Alcohol use disorder, also referred to as AUD, is a diagnosis characterized by an increased tolerance to the effects of alcohol consumption, impaired control over the consumption of alcohol, a presence of psychological and physiological harms, or withdrawal signs and symptoms. Those with AUD typically experience significantly increased rates of mortality across their lifespan. Some of these symptoms may be associated with nutrition deficiency. There is a wide range of symptoms associated with alcohol withdrawal, including confusion and auditory or visual hallucinations. Some of these symptoms, like I said, may be associated with a nutrient deficiency. For example, Wernicke encephalopathy, also referred to as WE, is a condition associated with thiamine deficiency. Left untreated, it can actually cause irreversible brain damage. So we do not want that in our patients. The aim of this review is to describe the nature of nutrition interventions for people admitted to the hospital for alcohol withdrawal, reported in the scientific literature, and the health outcomes achieved. Now covering the methods utilized in this systematic review. The review protocol registered with Prospero. To familiarize you with Prospero, if you are not already, they accept registrations for systematic reviews as well as rapid reviews and umbrella reviews. But we'll be focusing on systematic reviews. The PRISMA protocol database used a few different databases. CINAHL, or the CINAHL, Medine, MEDINE, PsycArticles, PsycInfo, Scopus, and Web of Science. Qualifying articles were assessed using the quality criteria for primary research produced by the Academy of Nutrition and Dietetics. And the length of hospital stay in individuals included in this study was 1 to 14 days. Eligible studies were those published in English, also in a hospital inpatient setting, with the primary reason for admission being alcohol withdrawal. Studies of this patient population with diagnosis of pancreatitis or liver cirrhosis were excluded. So anyone who happened to be included from the beginning were excluded if they happened to have liver cirrhosis or pancreatitis. All right, now to cover the results of this study. Out of all of the studies considered, 14 studies actually met the criteria inclusion and were considered for this study. The heterogeneity of the studies, only a descriptive analysis of the interventions could be achieved. And overall, the body of evidence was limited, particularly because there was such a varied and wide range of participant age, study designs, and then also the duration of the interventions. Nutrient intervention supplements considered were supplements of thiamine, multivitamins, amino acids, antioxidant compounds, probiotics, magnesium, and nutrition education. Because we are always about that nutrition education. Always. Outcome measures to be considered were memory function, biochemical and anthropometrical indices, withdrawal symptoms, bowel flora, and nutrition knowledge. So this is figure 1, and it is a flow chart depicting the inclusion and exclusion of articles for the systematic review. You can see that they began with quite a few studies. It's 17,679 studies. And through the process of screening and determining eligibility, the final number of studies included was 14. So it's quite significant. All right, so conclusions determined. There were a wide range of nutrition interventions identified, though mostly supplement inadequacies were what was focused on. It was also determined that in future research, it is important to consider total dietary interventions and studies on the perspectives of people undergoing alcohol withdrawal. It might be of our benefit to view the issue from the perspective of those experiencing the issue. Inpatient guidelines are currently in effect for alcohol withdrawal, and it focuses on supportive care. From a nutritional perspective, it's important that it's focusing on adequate oral intake, the utilization of supplements, adequate hydration, and monitoring nutrition status. As previously mentioned, thiamine deficiency is quite common amongst this population of individuals, though patients may benefit from also monitoring their serum electrolytes, their calcium levels, magnesium, iron, and general vitamin levels across the board. These patients may have poor dietary intake or may be at risk for refeeding syndrome, and that is why it is very important to stay on top of monitoring these levels. Patients with AUD display a range of neurocognitive deficits and inhibitory control. Cognitive impairments are likely to impact the efficacy and management and compromise treatment outcomes. There were 0 identified studies included in this review that focused on addressing malnutrition, despite the known risk within this population. The interventions included in this study, in this systematic review, were nutrition education, supplementation, and provision of food products. These supplements referred to in this particular review were intramuscular, oral tablets, and or fortified foods. And then the provision of food products included hot meals and or meal rations. Holistic, individualized nutrition interventions post-admission should be developed by a trained nutrition professional, for example, a dietitian. And the hospital length of stay is likely to influence efficacy of treatment and overall health outcomes. All right, and there is my reference. Thank you guys so much for watching, and I hope you have a wonderful day.